I know you're wondering, how long does my loved one have? And the answer is, it depends. But let me explain what that actually means. Okay, good news, bad news. Good news, there are some timelines and signs and symptoms we can look at to see how far along your loved one is until death, which I will get into. The bad news is there is grayness around the end of life, and that is the truth. And I'm going to explain some of that grayness so we can maybe look at this timeline a little differently. The reason why your doctor or the hospice nurse you're working with is telling you, we don't know how long until your loved one dies, or it depends, or you never know. They're not just saying that to ease your pain. They really mean it, because we have learned over time, specifically me as a hospice nurse, I have learned that you never really know. Sometimes people will show all these signs and symptoms and you think, man, they're gonna die any day, and then they don't. And sometimes people look totally fine and then they die the next day. So there is an unpredictability of death. There is a gray area around death. And that is why so few of us are willing to really put our necks out there and say, your loved one probably has a couple weeks left. But there are things we can look for, and I will get into that. So first, let's talk about those things, okay? Then I want to talk about the gray over here, because I think that's the most important part. But the things you can look for. First, I am talking about someone who is already on hospice, right? So that tells you right there, some doctor somewhere has said they have less than 6 months to live. So if your loved one's on hospice, they have been categorized as someone who could potentially die within 6 months. Will they? We don't know, but they potentially could. And usually that's because of their age and or the disease they have, right? So sometimes it has nothing to do with age because they are young, but they have a type of cancer, and we know that type of cancer is terminal, and they're at a certain stage in that cancer that shows us they're probably going to die within 6 months. Or it can mean someone is 98 years old, they have vascular dementia, and they've had an infection recently, and they haven't been eating. That can tell us, well, they maybe could potentially die from all of those things combined within the next 6 months, right? So it does truly depend on who you are, the disease you have, right? In order to even get to this how long do they have question, I am talking about the people who are already on hospice or who have already been told that they're getting towards the end of life. So that's the first and foremost. So if that sounds like your loved one, then the things you can look for are, how much are they sleeping? How much are they eating? Those are really big indicators, okay? So if your loved one is sleeping 20 hours a day and eating only bites of food a day, right? That can tell you that they may be getting quote unquote closer to death because they're sleeping more, eating less. Sleeping more, eating less. And maybe they're sleeping more than they are actually awake. That can be an indicator that death is quote unquote near. The reason why it's so gray is because people can live a long time like that. And it depends on what kind of disease they have. There are so many factors, right? Like the thing I think of specifically is someone with dementia. Someone with dementia, they're 82, they're sleeping 22 hours a day, only eating 2 yogurts a day, right? Their loved one's like, how long can they actually live like this? Specifically with that example, a long time. I know that sounds crazy, but that is true. And that is why so many healthcare providers are saying to you, we don't really know. And that's the truth. There could be someone who is a little bit younger, but they have a very specific terminal illness, let's say pancreatic cancer, metastatic, very advanced. If they're sleeping 22 hours a day and only having a couple yogurts a day, because of the disease specifically, I would know as a hospice nurse that they likely are going to die probably within the month. And I can get a little more specific because they have a terminal cancer that we know people can die pretty quickly from. And if you aren't eating and you're sleeping all the time with that disease, that can kind of give us a better idea that they're likely getting towards the end. And it could be maybe a month away. So you can already tell, right? Even as I'm going through this video, you can already tell that what I'm saying over here, the concrete things you can kind of look for, is still kind of in the gray area because it all quote unquote depends. And that's why it's hard to make these generalized videos for everybody because there are very specific examples where two people can be eating the same and sleeping the same, right? They're both sleeping 20 hours a day. They're both eating 2 yogurts a day, but this person could live longer like that because their disease is dementia. And this person with pancreatic cancer, end stage, will likely not live as long as this person because of the disease. Does that make sense? So there's many factors that we look at as hospice providers, right? The factors we look at would be, what disease do they have? How old are they? What symptoms are they showing? And then again, how much are they sleeping? How much are they eating? Are their symptoms increasing? How long have they been on hospice? What's their functional status? Can they get out of bed? Can they not get out of bed? Are they incontinent, right? There's all these things that come into play. And a lot of times the big thing we look at is, which disease do they have? I always talk about how patients on hospice who come on with some kind of metastatic cancer, their decline is much more, downhill decline and usually quicker. Whereas someone who comes onto hospice with a chronic, life-limiting, long-term illness like COPD, CHF, dementia, Alzheimer's, their decline is not like this. Their decline is like plateau, steep decline. Crawl back up, plateau, steep decline. Crawl back up, plateau, steep decline. So it's a lot more gradual. I'm saying all of this to help people see how, unfortunately, surrounding death, there is a lot of grayness. It's not black and white. And when something is as scary as losing your loved one, everyone wants answers. Everyone wants control, and answers give us a sense of control. So you're not weird for wanting to know these things. You're very, very normal, and it's because we're lacking control and we feel scared. So the more we know, the more we think we can control the situation. And I just want to, bring awareness to that and bring awareness to the grayness of it all. But there still is education that can help you at least understand the process of death and dying. So generally speaking, right, increase sleep, decrease food and water intake, both very normal things at the end of life and are somewhat of a sign to tell you if things are getting closer to death, okay? So you can look out for those. Functional decline. Someone will be, up walking, talking, and then slowly it'll be like they're in their bed more. And then next thing you know, they can't get up to go to the bathroom. Next thing you know, they're incontinent. When you start seeing those subtle changes, that can tell you that things are getting closer. They may have increased confusion, or maybe increased confusion at night or when they first wake up, right? That can also tell you that things are starting to slow down. Again, eating less and less and less. Now, all of these things are nothing to quote unquote worry about because these are the normal parts of death and dying. But those are things that can kind of clue you into, oh, this is like the normal progression. My loved one is declining. They are slowly decreasing. It's usually this gradual progression. I personally think that all of these things are wonderful to know, and to know that they're normal and to have signs for you to look out for, like, okay, this could mean that they're getting closer, but generally speaking, they're close. That's what I always say. When someone says, how long do they have? How do we know? You know what? Let's just take it each day and take each day as we don't know exactly when they're going to die, but we do know it's close. And because of that, what are we gonna do? Meaning, like, how do we want to spend our time? I would try to reframe it like that. Instead of trying to know when they're going to die, let's reframe it as, well, it's gonna be soon. We do know that. Soon as in 6 months, maybe? 3 months, maybe? And with that knowledge, that's still 6 months, 3 months. Hey, that's all soon to me, right? And because if we know that, let's treat each day as like, how do we want to spend these last days with our loved one? What do we want to do with them? What conversations do we want to have with them? It's not a time of like, well, when do I call people in? The time is now. That's what I think. Don't wait. Don't wait until they're 2 weeks from death before people start visiting. No. People need to visit now. And I know there's logistics, right? Because I'm already thinking this in my head. Well, we need to call off work. And how do we know when to take time off work? Listen, work is going to come and go. If this is your person and you love them and you want to be with them towards the end of life, this is it. It doesn't matter if they have 2 weeks left or 6 months left. You take that time off work. You go be with your loved one if that's what you want to do now. If you don't want to do it, that's not the relationship you have, then don't do that. But please know that anyone on hospice is getting close-ish to the end of life. You take that time off work. You go be with that person. The time is now, whether it's 6 months, whether it's 2 weeks. And I always say I'd rather visit when they're 6 months out, because at least then they can still talk to you and stuff. When they're 2 weeks out, they're usually not really talking. They're sleeping a lot more. So there's something you can really hold on to, right? The further away someone is from death, the grayer the timeline's going to be, and the more aware they're going to be. So the further away they are from death, they're going to be conscious, awake, maybe talking to you if they have the cognitive ability to do that, talking to you, walking around, eating, things like that. The closer someone is to death, the more unconscious they will be, the less and less and less and less and less they will be eating, the more they'll be sleeping. They won't have physical ability to do anything, right? So once they're getting that way, that should clue you into they could be close to death. The difficult part here is depending on the disease, right? Depending on the disease. Someone with Alzheimer's dementia, I keep bringing this up because that's the one that doesn't really follow a timeline. That's why it's so hard. Alzheimer's dementia, someone could be bedbound, incontinent, not talking, barely eating for years. So that's why I have a whole entire video about when we say we don't really know, it's because we might not really know. And definitely with specific diseases like something like Alzheimer's or dementia, it's very difficult to know because it doesn't follow the same timeline. It's kind of up and down, up and down, up and down. There is a very specific time in the death and dying process called the actively dying phase where we can definitively tell you, yes, death is imminent. And I would actually encourage you to go watch some of my other videos that actually show real life actively dying so you can see what it looks like. But actively dying is the very last phase of life, and it's one of the very definitive, easy to see, signs that death is definitely near, right? But that's not till the very, very, very end. When someone's in the actively dying phase, they usually have a couple days to a few hours left. And that looks very specific for everyone. And that is, they will be fully unconscious, not waking up at all. They will have no food and water for likely days. They will have changes in breathing. They will have changes in skin color. And they will have something called terminal secretions, AKA the death rattle, which basically means you hear this gurgling noise. It's kind of like the death rattle, meaning death is near. I have a whole slew of videos about what that's like, why they're not in pain. So please go check out those videos if this is the first video you're seeing of mine. But that is definitely a definitive end of life set of symptoms that as healthcare providers, when we do see those, we can give you a definitive answer. Yes, we think your loved one is likely going to die within the next couple days, next couple hours. We can give more concrete answers because the closer someone is to death, the easier it is for us to predict death. The further they are from death, the harder it is for us to predict death. This video is not to make you not ask that question. I think asking that question to your healthcare provider is a beautiful thing and it gets the conversation going. So please still always ask your hospice company, your doctor, if they're the ones referring you to hospice, ask, how long do you think I have? Or if you have an oncologist and you're on your second treatment, right? And things aren't looking good or you're not feeling good, please ask them. You can ask, hey, what do you think the timeline is here? And if they say to you, it's really hard to know, you can still push back and say, okay, I get that. But typically speaking, with my specific disease, where I look right now, what do you think? Because there are patterns. We do look at patterns. They may be able to say to you, listen, I don't know for sure, but generally speaking, someone your age with this disease, with the treatments you've done, maybe a year or two or whatever, I don't know what they'll say, but you can keep asking that question, push back if they say they don't know, and then also know that if they continue to say they don't know, what could be happening is what I've explained here. There is grayness around the end of life, and sometimes we just don't know, but please just try to be there with your loved one. You might not know the exact date, of course, or when it's going to happen, but just know it may be happening soon, so let's cherish every moment.